Some of our favorite people here on the stage. Not that I don't love all our patients, but we all have favorites. So with us today is Abigail Carter. You can stand up if you're comfortable, or would you rather sit, Abigail?
Would I rather stand?
Can you stand, or is it easier for you to sit?
I look cute sitting.
You're cute? Sit if you want to sit. Okay, so Abigail has been a patient of ours a number of times. You guys have heard enough of me talking, so I'm going to shut my mouth and let Abigail tell you a little bit about how we've all come to know you and work together and some of the experiences that you've had with Englewood Hospital.
Okay, I became a patient in 2014, but before I became a patient, it was my husband. He was in need of, a knee replacement. We had a local doctor and had been caring for us for years. But in doing so, the local doctor finally said after a while, even though he respected our wishes, that he said he wouldn't be able to do the knee replacement on my husband without any blood. So what we did, we thanked him for his service. We appreciated it. And we just got on the phone and we talked to you. We talked to Robin. We got the necessary doctors, Dr. Feldman, David Feldman. He performed the surgery, no problem whatsoever. And then since he was my husband's doctor, he became my doctor. I had arthroscopic surgery in both knees. I did fine, loved the hospital. It was home away from home. Yeah.
No, so Abigail, there are closer hospitals to where you live, right? Okay, you can clap, that's good.
Yeah, there's closer hospitals there, but the thing is, they don't have a full staff bloodless program in medicine. And when you go in the hospital, for whatever reason it is, when they take down your information, you tell them that blood is not an option. And since bloodless care is important to me, well, then I have to think about it. Why are you asking me these questions and why are you proceeding? And there were a few friends that I went to the hospital with. It ended up turning out they were serious situations where they wanted to perform surgery. And the friends told them no, that blood was not an option, but the doctors insisted, in order for you to live, you will have to have this. And so eventually I told the sister, I said, get on the phone, call Englewood Hospital, and eventually you transported her here. She had the surgery. She's doing fine. You want me to go on?
I know you can. I'm going to stop you for 1 second, just make it, because you brought up a very good point, Abigail, and that is we hear from lots of other hospitals, both in New Jersey and around the country. They say, what have you guys been doing up there for 21 years? We want to have a program like that. We want to have a bloodless center. And some of them start to develop some things. You all in the room have heard about some of those efforts and initiatives, and that's not to discredit them. We want people to do this. But what we see most often with those hospitals is they sort of give this job of developing this program to somebody who already has a job or a couple jobs in that hospital, and they pile yet another one on top of that. And it's very, very difficult, right? Hospitals are busy places. Healthcare's gotten complicated. And it's very, very impossible to even think that that's going to be developed successfully. So here at Englewood Hospital Medical Center, I'm fortunate enough to really have a lot of people who work with me. I have a staff of, there's now 9 of us who work actively with the program. We're not employed by the Watchtower Society, or we're not volunteers. We get paychecks and they come from the hospital. But the hospital has chosen to allocate those funds to have a large number of people who are here to care for your needs. And only that. We don't all have other jobs. We are here to be part of that bloodless center. And I think, Abigail, you can see that makes a difference.
Yes, it does. And what I like really about Englewood Hospital, as you say, I came to know you, your whole staff, and I appreciate it. I'm the type of person, I like to talk, as you say.
But it's all good.
But I'll try to make it as brief as possible. You know, in coming to this hospital, I like the way they treat me. I like it because you're educated. And as 2 of my doctors already know, I'm the type, I'll self-diagnose myself. Dr. Fiorello told me, you shouldn't do that. I said, but that's me and my treatment. Can you deal with it? But in going with the other doctors, my local doctors, they became annoyed, with me. Because my thing is, I have to be proactive. I have to find out what are you going to do ahead of time So then what I do with my local doctors, or my former local doctors, is I will question them. I will ask them, what would you do if I had some sort of traumatic happening, I fell, I hit my head, I'm bleeding? How would you treat me? So they're puzzled, and it ended up that one doctor told me I can leave, but which was okay, because I ended up coming to the seminar, I heard the doctors here, and afterwards I automatically said, because of what they said, what they were listing, I had those problems. And now, do I love my doctors? And I think they love me.
They do, and so do we. Abigail, thank you for being with us today. So next we have the Lazarskis, Walter and his beautiful wife. And so, Walter, I, again, will say very little, and I'm going to let you tell your story. And actually, I know that one of the people who took care of you is here in the audience, Dr. Bernick. So I don't know if you want to make your way a little bit closer, because I'll ask you to make a few comments, Tom, if you don't mind. But in the meantime, while he's coming, Walter, can you tell us a little bit about how you came to be part of this?
Well, before I tell you about my fine relationship with Dr. Bernick, I'd like to take you a little bit to the darker side. Prior to the time when we had such a beautiful facility as this one, with the Bloodless Surgery Institute. About 30 years ago, I was serving in a congregation up in Monticello, New York, that's Sullivan County, and we went to visit one of our congregation members, not knowing there was any serious problem. We knew she was in the hospital for a couple of days. We went to visit her cousin and myself, both serving as ministers. As we walked in the door, we found out there was a court order right then and there for a blood transfusion. This is what happened 30 years ago. Maybe some of you have read about it. Others maybe have, heard that we had court orders, and sometimes forced blood transfusions. Sometimes we had people who supposedly had died because they didn't want to take a blood transfusion. We've been on both of those kinds of experiences 30 years ago. So we walked in and we were invited to a court. The doctor was there who was forcing the transfusion, the judge, a stenographer, the two of us, and hospital staff in a little tiny room. And the judge listened to the complaint from the doctor. The patient was a female patient. She had a gynecological problem. She was bleeding heavily. Her blood count was 4.5. The judge asked, when is the last time you examined her? And it had been more than 24 hours. So he stopped the hearing right then and there and sent him out to re-examine. Her blood count had not changed. It was still 4.5. What could be done about this? And we actually found ourselves to be more knowledgeable, and yet I am not a doctor. I have no background in this, but we had just received beautiful training through the publication of our organization. The first thing you do is stop the bleeding. Second thing you do is look at what could be used for an expander, Ringer's lactate, erythropoietin, iron. The judge said, well, has any of this been done? No. He stopped the case. And this young lady, mid-30s, was out and back to work again 5 days later on light duty. Another case, I'm not going to go deeply into this, but a friend of ours died because she had been given nothing for 5 days. I was on vacation, so I couldn't look after her. The day we left, I spoke with her. She was sitting on the edge of the bed, healthy as anything. Needed an operation. She had cancer, refused a blood transfusion, same hospital. And at that point, 7 days later, I came back, and she was in a coma. Died the next day. She had been given not even intravenous for 5 days, nothing. They just kind of set her aside. So I went to the staff and I said, is she going to die from starvation, from dehydration, or because she refused a blood transfusion? Well, they put her back on hydration, and she died anyway a day later. But getting to my story.
Yeah. So then it was your turn in
Yeah.
life.
My wife will fill you in on some of the details here.
Well, my husband's had a few times that he's been in Englewood for different things. And the most recent case is he's had deep vein thrombosis. So he has something to show you how long his stitches are. He's had 2 surgeries within 6 weeks. one on the right leg first, and then just recently the left leg. But my whole viewpoint of this is how quickly our lives can change in a short period of time. The first leg surgery, we thought it was a pulled muscle, went to an urgent care. They sent him home, said he had a blood clot, but sent him home with blood thinner to inject in his stomach himself that night. Woke up the next day and could not walk from the bed to the bathroom. So we got him back down to urgent care. They said, oh, well, you have blood clots and you have aneurysms behind your knee in both legs. So they sent us to the emergency room. The second visit to the urgent care was 7:30 in the morning. To make a long story short, by 10 o'clock that night, we finally saw a vascular doctor. We were in the ER that whole time. We sat in the waiting room for 2 hours with a blood clot in his leg, waiting to be seen by the triage nurse. Finally, when the doctor came in, he did an angiogram on him because the pictures that they took couldn't be seen well. So the doctor kept saying to us, you know, this is a high risk for people like you. He said it over and over again. And finally I said to him, what do you mean people like us? He said, well, you know, witnesses. This is really a high risk. And so we said, well, we're willing to take the risk, but it doesn't change our conviction. So I said to him, so please tell me now, you tell me what you can do without blood. And he didn't really have a lot of answers. And not to demean the doctor, but the hospital is projecting themselves as becoming bloodless. But they're not really there yet. He said, well, we could try to get a team and take care of your husband. I'm like, you don't have a team? No, we need to have a team in advance. We're not going to prepare a team tonight. So anyway, we already knew before we got too far with it that we were calling Englewood, our dear friends in Englewood. You can call them anytime. And that's what we did. And I have to say, every time we get into an emergency situation and we get transferred out of the local hospital and I walk in the doors of Englewood, I feel comforted. Because it's a lot of tension for the caregiver, especially when it's your husband, you're the wife, and you have a lot of emotions going on. But I just feel so relieved when I walk in the door in Englewood that I don't have to think about all the medical aspects. I can trust the nurse, I can trust the doctors to the fullest, and they'll take care of it in the right way. And so I'm very thankful for all the hard work that the Bloodless brothers and sisters have done, and the doctors are amazing that work with this hospital, and I really, really appreciate. Even the food is good.
That's true. Thank you.
So everybody likes to show their scar, but I'm going to keep you from that awkward moment. But I brought something to show you the length of my scars on my legs. This represents one leg, okay? And you put them all together, I got 45 inches of staples in both legs. And I thank Dr. Bernick for that. Not in a bad way. I think he saved my leg because I think at the other hospital I would have lost it. And I don't want to be too humorous here, but I do want to thank Dr. Bernick also for the loss of 20 pounds that I've been trying to lose for years. And finally, in 6 weeks, and I told Dr. Bernick after the first leg was done on June 6th that I'll be back. He said, come back in 6 weeks, 4 weeks, come back. We'll have the other leg done as well. As soon as I can play 18 holes of golf, I'll be back on July 4th. I played 18 holes of golf, and I played pretty good. And the next day I called him, and he said, yeah, come in next week, we'll do it. So I'm hoping to play golf again in 2 more weeks. But, you know, aside from all of that, really, this is a marvelous institute, and we're so grateful for it. Dr. Bernick, Dr. Madigan, my cardiologist, did a fantastic job with 5 stents some years ago. And I'm really a healthy guy, but for some reason, I still have to have work done. We're in a state of repair at this age, I guess. So thank you very much for your time as well.
you. So just as a final comment, this is Abigail. You can comment, or Walter, you can comment very briefly. You both, right? Abigail, you already said you drove by a lot of hospitals. You drove by a lot of places that you could have been. Don't speak to me, speak to the audience. What would be your advice in terms of making those choices?
I would advise, don't hesitate to call whatever hour you need to be transferred to Englewood Hospital. Someone will get back to you shortly, and they will take care of the transfer for you.
And I've been an advocate of Englewood Hospital since they opened their doors to the Bloodless Surgery Institute. Always encourage persons to come here from our locale, and of course it's their choice. And then I became a patient myself in 2008, but I really would encourage people to use. We have a problem. My wife and I are moving out to Portland, Oregon within another month and a half, and it's hard to fly 6 hours to get treatment here, but if I need to, I'll be doing that.
And I personally will encourage all people who don't use the doctors and their specialties at Englewood to really reconsider, because you have to be proactive, and if your local hospitals don't have the bloodless surgery program, then you could be asking for trouble, and we don't want that for yourself or your family. So you heard the doctors today. They told you, come on in, try them. They are willing to help you. So that's what we encourage you to do.
Thank you. Thanks, Abigail, Pauline, Walter. Thank you for being with us today and for sharing your experiences. And I think they'll be here for a little while when it's over if you want to speak to them personally.